Hi, are you the day shift nurse that's taken over my patient in room 325A? Great, are you ready for report? Alrighty. So the patient's name is Mr. John Doe. He is in room 325A. He is a 77-year-old male. Code status, he is DNR/DNI. He does have an allergy to penicillin. So the story with him is he was admitted with a COPD exacerbation. He was brought to the ER by his son, James, early in the evening last night and was transferred to us around 9 p.m. So he does have a past medical history of COPD. He smoked for 50 years, he says, about 2 packs a day, but he did quit last year cold turkey. He also has a history of hyperlipidemia and hypertension. His vitals with me have been pretty good. His last blood pressure was 134/84, and that's been pretty stable for him throughout the night. 130s/80s usually for me. His heart rate has been in the 80s and 90s. He is on 2 liters of oxygen. He is been setting for me around 89 to 90%. His goal stated by respiratory is to keep him between 88 and 94%. His baseline is that he is on 1 liter of oxygen at home. So we're at 2 liters right now. Neuro-wise, he does have an EMV of 15. He's alert and oriented ×4. He does have a bed alarm in place in his bed, but he has been calling appropriately and has not made any attempts to get out of bed without calling for help. So, been super good. Cardio-wise, his pulses are 2+, strong and even. Like I said, we've had a little bit. He has history of hypertension, but it is controlled with his home meds, which I'll talk about in a little bit. Respiratory-wise, so his lungs are diminished throughout with some fine crackles in the bases that I've noticed. He does have shortness of air with mild activity. So when we've gotten up a couple times, his sats have dropped to 86 to 87%, still on that 2 liters of O2. So when he is in bed, he's usually around 89 to 90%, like I said before, and he's on 2 liters of oxygen. GI and GU, so he's currently on the DASH diet. Last night it was reported that he ate 100% of his dinner. He does also report mild shortness of air when eating, but his sats did not drop when eating. He has been getting up to the bedside commode. He is a standby assist. His bowel sounds are normal active in all 4 quadrants. He did have a bowel movement yesterday, and his normal is 1 to 2 bowel movements a day. He voided 5 times during my shift. Each time was about 100 to 300 milliliters each time. He is continent, and he has been using the urinal at the bedside. As far as his pain level, at the time that I got him, he was reporting his pain as 3 out of 10. We do have an order for PRN Tylenol, and since then his pain level has been controlled. The last time I went in there, he reported pain as 0 out of 10. He does not have any skin issues, and he currently has SCDs on his legs and has been very compliant with those. He does have an IV, an 18 gauge in his left forearm, currently is saline locked. I flushed it this morning, looks great. Clean, dry, and intact. As far as his meds, he is on PO Lasix daily and PO Metoprolol daily, and again, we have an order for PRN Tylenol if needed. His activity level, like I said, he uses the urinal at the bedside independently, and he is a standby assist otherwise. So his labs that were back this morning, his potassium level was 3.2, so we did end up giving him 40 of PO replacement today. He did have a chest x-ray in the ER, which did not show any pneumonia. It did just show emphysema and some hyperinflation. And they did say that they will be doing a repeat chest x-ray in 2 days. So watch out for that. Social-wise, he does have 2 sons and 2 daughters. They have called in his room a couple times, but he's able to answer the phone and talk to them. His eldest son, James, was with him for dinner last night. He left for the evening, but he said that he would be back sometime in the morning, and his number is on the whiteboard in the room. So John Doe has lived independently. He is a widow, and his wife died 5 years ago due to COPD, so he's a little bit anxious about the situation, but has been super nice, very compliant, and we've had a pretty good night together. I think that's everything I need to tell you. Do you have any questions? Alrighty, have a good day.